We'll get started. Good morning, everyone. Welcome, bienvenidos. For those of you who want to continue in English, please stay put. And las personas que desean escuchar la versión en español, por favor, elegir el idioma oprimiendo el botón en forma de círculo donde dice español en la parte inferior de la pantalla. Gracias. So good morning to all of our live attendees today. We are so thrilled you're here to engage in this exciting webinar using the Multicultural Orientation framework to integrate racial justice and behavioral health care. I'm Dr. Tiffany O'Shaughnessy. I'm one of the hosts of our webinar today. I use the pronoun she, her, and I'm a white cisgender woman in my early 40s with an undercut buzzed hair on my left side and chin-length purple hair on my right side. I'm wearing a black top and my background is an office with a fiddle leaf fig, beige couch, and a blue floral painting. I am a professor and the MFT program coordinator in the Department of Counseling here at San Francisco State. I am one of the co-investigators for this project and working alongside the project's primary investigator, Dr. Julie Promiser, who's our department chair, and my co-investigator, Dr. Molly Struer, who's the coordinator of our school counseling program. I would also like to thank our graduate assistant, Sarah Guerrero, who is working hard to stay on top of the technical issues, chat boxes, etc. today, and say hi to her in the chat. I'd like to acknowledge that SF State's campuses in San Francisco sit on the ancestral homeland of the Ramaytush Ohlone. We further acknowledge that we work on the ancestral lands and waters of many other indigenous peoples and nations in our field work in the Bay Area and around the world. We also acknowledge the enslaved peoples, primarily of African descent, whose labor built many of the facilities that we gather in, and those of the United States. To move this statement from acknowledgement to action, we encourage you to learn more about the Ohlone people and lend your time, talent, and other resources and service in whatever ways you deem right and true for you. We're committed to ensuring this webinar is accessible to our audiences. Closed captioning is available in the closed captioning option at the bottom of your Zoom screen. If at any time your access needs are not met or become not met during the webinar, please send a chat directly to a host or co-host. Access is always a work in progress, so we appreciate your comments, feedback, and support. This is our second webinar of the year, sponsored by our Equity and Justice Focused Integrated Behavioral Health Counselor Training Project, which is fully funded by the Department of Health and Human Services, Health Resources and Services Administration as part of an award that totaled $1.9 million. A couple of additional things before we begin. If you are one of our HRSA stipend recipients or are interested in receiving continuing education credit for your attendance today, please pay close attention to the announcements provided in the chat for sign-in and evaluation links. Our thanks to our partner, Counseling and Psychological Services at UC Berkeley, who are approved by the American Psychological Association to sponsor continuing education credits. As a reminder, this is a live recorded Zoom webinar. Therefore, the audience is not visible and the audience can't turn on the video or audio. The chat function is available for comments, sharing of resources, supportive emojis, etc. To ask the presenter a specific question, please post your question in the Q&A function. The Q&A will occur during the last 10 to 15 minutes of the webinar, so please post your questions as they emerge, and the presenter will answer questions at the end of the webinar. If we can't get to all of them, we'll ask you to contact her directly. Her information will be posted in the chat. And so it is with great pleasure that I introduce today's presenter, Dr. Karen Chow. Dr. Karen Chow is an associate professor in the counseling and counseling psychology in the Department of Educational Psychology at the University of Utah. She also directs the counseling psychology doctoral program. Karen's clinical and research interests are guided by an overarching goal to reduce disparities in the access, service, and quality of mental health and education for historically marginalized groups. She is interested in the questions: how do people negotiate conversations about difference in culture, and why does multicultural competence matter? Karen conducts research in medical, counseling, and school settings, utilizing qualitative and quantitative methods to identify cultural factors related to client improvement and student academic persistence. I have been so fortunate to know Dr. Chow for several years, working alongside her in the Association for Women in Psychology, and I'm so excited to continue learning from her today. So thank you again for joining us today, Dr. Chow, and please take it away.
Thank you so much for that introduction, Tiffany. I am so honored to be here, and happy Friday to y'all. Thanks for joining this webinar. So the focus of today's webinar is using the multicultural orientation framework to integrate racial justice in behavioral health care. And we have just under an hour, and I have lots prepared for us to engage in. Just an FYI, I do like interactive webinars as much as we can. I'd love to hear your thoughts, questions, as we kind of continue. And so I'll invite that as we move forward today. So here's a little bit of a roadmap of where we're headed. To begin, we'll set some intentions for today. I will talk about a concept called cultural fortitude. We'll dive into the multicultural orientation framework. We'll find out a little bit about why MCO matters. I'll share a little bit of the research that has come out around multicultural orientation, what it means to build an MCO mind, and we'll do a little bit of practice and see how it lands for y'all, and we can try some of the skills out. So before we dive in a little further, I'd like to invite you into reflection. I'd like you to think about a time when you learned something new about someone you thought you knew very well. Maybe a client, maybe even a good friend or family member. You thought you knew them really well. And then were surprised by what you learned. So I'll give you a moment to think about a person. And when you have that person in mind, how did it feel to learn this new piece of information? How did it influence your subsequent interactions, or maybe even change your relationship? And what did you learn about yourself? So I'd like you to hold this person in your heart and mind as we talk about the concepts today, the framework multicultural orientation, because I find that when we have a touch point, someone that we can really connect some of these ideas to, they become more applicable, they become more integrated into how we might view relationships and interactions. For me, the person that comes to mind is my own parent, who I had a conversation with the other day, and he's getting older, and he shared something that he'd never shared with me before, and it just opened a whole new realm of understanding. This is someone I've known my entire life, and this new piece of information has really shifted, almost tectonic plate shift in terms of the way that I have been thinking about him as he is entering into the kind of last stage of his life. And so there's always more to learn about someone, even though you think you know them really well. We're evolving and changing people. Next, I'd like to introduce this concept that I've been sort of sitting with and fiddling with in terms of how I like to think about it and apply it. And it started in the sort of post 2016 time of my life where I was feeling pretty demoralized, pretty down about our sociopolitical climate. And I was saying to folks before today's webinar, I'm feeling that again. That, life is not linear. And I feel like I'm in a place again where I'm unsure of how to engage in conversations, particularly ones that are culturally charged, where where polarization is happening, where I feel my emotional bandwidth stretched to the so thin. And so this idea that I've been really sort of sitting with and developing and talking about with colleagues and friends and even family is called cultural fortitude. And here's a mouthful of a definition, and we'll break this down in some way as we spend time together today. So, cultural fortitude is the cognitive, emotional, physiological, and interpersonal courage or strength in the face of psychological discomfort, which can spark motivation and courage to move toward racial repair and cultural healing. So to distill this a little bit further, because there's all these big words in here, is really when we get uncomfortable in cultural conversations, whether they are about identity, religion, politics, social class, disability, any sort of discomfort that we feel, there is often a very natural tendency and desire to move away. Sort of evolutionary, really. When we are uncomfortable, we want to go back toward equilibrium. And I know that many of us in our space today are trying to figure out how we stay in the room, even when it's uncomfortable. And so for me, cultural fortitude is this idea of like, how can I lean in even when I'm uncomfortable? How can I lean in service of racial repair, cultural healing? And I think many of us in the room today are also in the business of rupture and repair. And that cultural fortitude, this idea can really ground us. How do we stay, even when we're uncomfortable? So, how do we do this? I mean, it's really a lofty idea, one that, I often don't have the cultural fortitude. There are many days where I'm like, nope, not going there, not going to lean in. I am avoiding it. I am going to remain silent. So it's hard. So, two of the frameworks or ideas that I think can help us and are that we're utilizing already every day in our work and maybe even personal life are multicultural competence and multicultural orientation. Many of you are familiar with the tripartite model by Sue et al. Multicultural competence, knowledge, skills, awareness. It's how we enact a desire to understand and bridge and connect across differences and sometimes some similarities as well. And my colleague and I, Jessie Owen, who's at the University of Denver, back in like 2011 or so, 2010, we started thinking a lot about what it would mean to add another layer to multicultural competence because it's not just what we do as providers, as helpers, it's also our way of being. What does it mean to sit in and share a space with someone where it's not just the things that we say or do, but it's sometimes the unsaid, it's the tone, it's our level of comfort, it is our way of being, thinking about Carl Rogers and what it means to be with someone. So multicultural orientation is really that spirit that we sort of overlay with multicultural competence. In terms of the research, which I'll share a little bit later, behavioral health outcomes, we know that they are influenced by both multicultural competence as well as multicultural orientation. And so for those of you who are interested, I can share lots of resources regarding some of that evidence. So let's focus on the multicultural orientation framework. And here is the Google Earth perspective, the bird's eye view of what MCO is all about. MCO is about creating a healing context where patients and clients can fully express their cultural selves. It is about recognizing how our behavior, our feelings, our relationship in the room, and our somatic or physiological responses show up in every interaction. So it is an embodied experience. MCO is about making the implicit explicit, the elephant in the room, naming some of the difficult stuff that's coming up that may be hard to bring up, but also can shift our conversation into something deeper and more meaningful. It is about considering the frame, which I will talk a little bit more in just a minute about. It is also about staying present. So this is MCO broadly, and I'm going to talk through the 3 pillars and provide examples of what this looks like. The first pillar, cultural opportunity. These are those moments in our interactions with a patient, client, um, where our identities come to the foreground in sometimes subtle ways and sometimes more like very apparent ways, and they offer opportunities to enhance dialogue. They offer opportunities for deeper exploration. So some ideas to be thinking about in our minds is like, how did, what Tiffany just shared, for example, about who she is, help me understand her a bit more and help me want to explore and understand more. And or a client might bring something up and we may not have broached it in the beginning, but it comes up often. And how do we remain curious to find out a little bit more about what it means for that person? Cultural opportunities show up in many different ways. They're not always explicit. And so let's kind of take a look and see what that might look like. So cultural markers are those indicators. It's just a fancy word for saying these are those moments that indicate that something important might be coming up culturally. So let's listen to a client say, this is between a client and a therapist. Oops, sorry. The client says, I think in part, it has to do with my being the only woman of color in my office. Like I feel so on edge without a feeling of community and connection with my colleagues, and it wears on me all the time. Okay. So we're going to see 2 ways in which I want you to maybe note, and if you would like to share with folks, like what are some particular cultural opportunities or markers in just this very short statement from a client. And you can put that in chat. And as folks are typing in some cultural opportunities, the therapist who focuses more on symptoms at this point says, I can see it on your face. You seem exhausted just talking about this. I'm wondering how this experience is affecting your ability to make the changes you've wanted at work and at home. So this is a very fine and appropriate response to the client. The therapist is using a little bit of here and now. I can see it on your face. You seem exhausted talking about this. The therapist is also focusing on how this client's experience might be influencing the way that they're feeling at work, at home. I think, exploring those pieces makes a lot of sense. And let's hear a different approach, just a little bit of a addition here. So a therapist who focuses on the cultural markers or maybe takes a cultural opportunity says, I can see it on your face. You seem exhausted just talking about this. It sounds isolating to be the only woman of color in your office. Would you share a bit more about what having community and connection would look like? So I'm going to pause here for you to kind of notice some of the shift in what this therapist says. And what I want to underscore is cultural opportunities often take the form of using clients' words specifically. So the client says, I'm the only woman of color in my office. And the therapist with the cultural focus uses that same identity in their response. It sounds isolating to be the only woman of color in your office. And while this might seem just like a little small shift in response, what cultural opportunities this offers is A, the therapist sees what the client is and has heard what the client has shared and disclosed. It's not a generic sort of like, I feel isolated or I feel lonely without community and connection. Her identity is connected to that experience. And so, with a cultural opportunity, we want to really be able to illuminate what clients bring in about their identities. So, this is an example of cultural opportunity. And there are many other ways in which this can show up. So here are some back pocket questions to think about when we think about a cultural opportunity. And the first question is, what aspects of a client's cultural identity are salient? What are you hearing? What are you noticing, either explicitly or implicitly? And how might this be important to explore further? So here's the thing that sometimes when I do a lot of training with brand new therapists, and sometimes they think like, oh no, I missed it. They said something and I didn't pick up on it. Um, that's okay. It's not a deal breaker. Our goal is to keep attuning toward those cultural opportunities, to listen for them. And if it is important to a client, it will come up again. And the next time you'll leverage that opportunity. Okay? So we keep practicing. Up on the top left or right side of the slide, I just highlighted the way in which MCO gets experienced and how we implement it. And it is through so many aspects of our body, whether it's relational, somatic, emotional, behavioral, that we're picking up on cultural opportunities. I'm going to move to the next pillar, cultural humility. So cultural humility, really broadly defined, is an other-oriented stance. How do we maintain and create a broad sort of perspective on the person or people in front of us that we're working with? It is about expansiveness, curiosity, and a genuine interest in the other person. So sometimes when we think about the concept of humility as it's used in other sort of contexts, it's sort of like we erase ourselves and we put everyone in front of us, that we don't matter. And I want to dispel that idea that cultural humility is that we are really clear about who we are. We are very clear about the way that we show up, how we influence the interaction, while also being very open and curious. So it's not about being neutral, it's about remaining open. And one of the ideas to kind of consider is there's always more that I can learn. So for those of us in today's space who have been providers for a really, really long time, there are times when we are introduced to a new client or patient we're going to be working with, and a lot of what they've written on their intake form looks similar to folks that you've met before. And it would be completely natural to feel a sense of, comfort, or like, oh, okay, I kind of understand what this client is coming in for. And MCO would say, what else? What else can I learn? This is a brand new person with a different lived experience. What are some other ways that I'm going to be learning something new? I'm a different person as a provider today than I was yesterday. How does that influence my interaction with this person? So each interaction is a new interaction. So let's take a look at what this might look and sound like. So just to provide some kind of strategies, many of you do this naturally already, but a big part of cultural humility is really listening actively, showing a genuine interest in a person's story, to ask openly, Tell me more about, can you say more? I'm really curious about. Also to reflect inward, being aware of our own biases. So there's a lot of reflexivity going on with cultural humility. Partner equally. How do we share decision making? How do we really enact collaboration? Learn continuously. Every client or patient teaches. Okay, so here is an example. The patient says, and this is one of my own, from one of my own experiences, and I don't think that I answered in the same way that this clinician did, but this is an example. The patient says, I think the reason I hear voices is because my auntie gave me mal de ojo. She cursed me. And the clinician says, thank you for sharing that with me. I understand that mal de ojo is an important belief in many cultures. Could you tell me more about how you think this has affected you and your experiences with hearing voices? So nothing really too complex, but the pieces I want to underscore here that the clinician is utilizing aspects of cultural humility is noting kind of some of what they might know and inviting the client in to tell them what it means for them. Being curious. And this clinician might know a lot about Maldeojo. They might come from a culture where that is a very sort of present and common idea. So there's always more to learn. Okay. So here are some questions that we can think about related to cultural humility. And the first is, what else is important to learn? And why am I drawn to this aspect of the client's narrative? What else? What can I learn? And the final pillar is cultural comfort. And these are the thoughts and feelings, the sensations that we have before, during, and after cultural conversations. And cultural conversations being any conversation where parts of who we are, our values, our worldview, our identities come to the foreground in some way. And sometimes there's friction, sometimes there's synergy. But what are they? And what comes up in our bodies? And it's also the degree of ease or calmness that we have in having cultural conversations. On the other side of it is discomfort, which is really important to sit with. Knowing what you know and don't know and being okay. It also involves some here and now dialogue, some immediacy, and we feel it in our bodies. So where does this show up for you? So what I would like to ask you all to think about is when discussing a culturally charged topic, and I imagine many of us have had some of these recently. Where do you feel it in your body? So I'd like you to enter it into chat and let's see where folks feel it in their bodies. Stomach, tension in my throat, stomach and gut, pressure in the head, center of my chest, the heart and a little in my scalp, my throat, my cheeks. Yeah, flushing in my face, lump in my throat, my heart, jaw and shoulders. I feel warm in my hands, tightness in my chest, a lot of chest, a lot of stomach, a lot of heart, chest to stomach. Yeah. So keep them coming. Identify where it lives when you are discussing a culturally charged topic. Where do you feel it in your body? A little shakiness. For me, I feel it. I get sweaty, my armpits get sweaty, and I tend to, when I know I might be having one, I might wear black, so because I know I get sweaty. I'm also kind of a bobblehead, And it's very counterintuitive for a lot of people because it's a self-soothing thing that I do. And I noticed this from when I was getting training as a master's student. And I would do this when I was culturally uncomfortable. And it was very paradoxical because what it looks like is I'm agreeing with the person that I'm sitting across, when in actuality, it's like I'm super uncomfortable. So they named me Bobblehead because I used to watch video and they were like, there it is. And so now I know that's my tell when I am culturally sort of, overly charged or feeling flooded. So why I ask you to um, identify where it lives in your body, because for the most part, we want to just like squelch it. We don't want to feel it. We want nobody to notice, especially the ones that are very visible. However, from an MCO perspective, this is really good data. It is our bodies feel before our brain sort of catches up to what might be sort of sparking this physiological reaction. So when you start getting sweaty or your chest gets tight or there's a lump in your throat, in the moment you're like, oh no. And the MCO mind would be, well, what is important for me to focus on right now? There's something important. This is important data. We are feeling thinkers. So the next time you notice that reaction, ask yourself, what's important for me to focus on right now? There's something that might be really important for me to lean into. Cultural fortitude. So somatic cues and what am I or not doing and how come? Asking ourselves. Okay, I'm gonna just give a little bit of a kind of digest version of what MCO has kind of how it's shown up in research. We have found that when therapists take cultural opportunities and clients experience that they are being asked to delve deeper into these aspects of their identities or values or worldview, there are better therapy outcomes. Same with group. When there is cultural humility as a group, openness, curiosity, um, just the expansiveness of understanding clients as a whole, as a group, improve. On the flip side, when we miss cultural opportunities in therapeutic contexts, there are more negative outcomes. Cultural comfort within group, more positive outcomes. My student Amira Trevino did this cool qualitative study on windows of opportunity because oftentimes we think if clients don't bring it up explicitly, like as a woman of color, blah, 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 then there are no cultural opportunities. And what she did in this study was identify all of the ways in which we can address cultural opportunities without directly naming clients' identities. And then more recently, Mel Wilcox and a whole group of us have done some research around supervision. And in one of our studies, we found supervisors who exhibit cultural humility and address cultural opportunities in supervision. There's greater satisfaction within the supervisory experience. Okay. I went through that really quick, but okay. What does considering the frame mean? And this is an interactive part of today, one of them. So I'm gonna just tell you one thing, which is these cows are sick. And without thinking too much, I would like you to enter into chat why you think they're sick. There's no right or wrong answer. Whatever comes to mind first, just type it into chat. So these cows are sick. Why? They are isolated. Thanks, Erica. Pollution, pesticides, the environment. So no one's taking care of them. Disease. Too small an area for them to roam. Keep them coming. No right or wrong answers. Whatever comes to mind, they are alone or isolated, not enough social interaction or affection. They live outside their natural habitat, surrounded by residential houses. So I want you to keep them coming. Whatever comes to mind first, enter into chat. And as you are, for those of you who have thought of one or put it into chat, I'd like you to think about what prompted your initial guesses. So for some of you, you might have had experience working on farms. Someone mentioned this not enough space. Some of you mentioned maybe insufficient sort of food, the environment, it's residential. Maybe you've had experience. For some of you, never had experience, you made a guess based on what you could see, so your visual cues. Maybe it has to do with, there's lots in the news right now about animal-related diseases and viruses, and it's the media influence. Maybe you read a book about climate change or the environment. You have knowledge about water and food and feeding animals. Some of you I saw had an emotional reaction to how cows appeared. I have a dog and she has the same face, but based on how I'm feeling or how I think she's feeling, I attribute particular sorts of emotions on her, even though she really has the same face most days. There's anthropomorphic reaction. There are so few cows and they're feeling isolated and maybe depressed. We live in a time of social isolation, and so maybe there's some countertransference. Or maybe the grass looks too green. There's something fishy going on. So our initial assumptions come from somewhere. And if I were to show you this next screen, which is a little bit broader picture of the cow's environment, how might that change your initial hypotheses? You might keep them the same, or they might change once you have a fuller picture. So the idea here being that every time we are in interaction with someone, there is the sort of this imaginary frame that we are viewing the other person through. And it doesn't tell us the whole story. So with multicultural orientation, we're always asking ourselves, we see a thin slice. What else am I not experiencing with the person in front of me? What is a fuller frame? And when we start to think about the fuller frame, we can see more and address more and hear more and feel more, and we can address more. So we can't address what we don't want to or try to understand or experience. And I want to sort of kind of provide a little bit of research around this in terms of if we don't pay attention, then we can't address it. So here's some recent research that has come out that folks may or may not be familiar with. So states with higher anti-Black racism, so entire states, is associated with lower effectiveness of psychotherapy with Black youth. I found that to be a chilling finding. So entire contexts where there is higher levels of anti-Black racism, counseling, therapy is found to be less effective. So what's going on there? What's the frame? In 2019, Williams et al. Conducted a study looking at collective trauma. And sometimes we think a lot about mental health as sort of individually based, but for a lot of the groups that we're working with, marginalized communities, there is collective trauma that's related to maybe one incident. So one incident of trauma of can affect an entire group of and community. Okay. Anti-Black racism is also linked to depression and anxiety in Black youth. Right? And in this study, they showed developmentally that as kids got a little older, it amplified its effects. And just a few years ago, a meta-analysis of 43 studies looked at racial discrimination and its effect on suicidal ideation and attempts across marginalized racial groups, right? And found that the more experience of racial discrimination, the higher levels of racial suicidal ideation. So I share this in terms of what are some of the frames in which we as providers, as helpers, are sort of looking at our communities and thinking about sort of healing and how we see or don't see sort of what's going on. And I want to link this back to the therapy room is that if we don't recognize what clients are bringing in regarding who they are, their whole selves. Again, MCO is about how do we help clients and patients bring their whole selves, help them and be seen in these contexts. So there a study that was done by one of my colleagues, Joanna Drenane, she did a study on cultural concealment where she asked clients, are there parts of yourself that you have concealed deliberately from your therapists? And then asked about their sort of outcomes in therapy and found that clients who withhold parts of themselves deliberately had poor mental health outcomes, right? So what this means is when we aren't leveraging cultural opportunities or helping clients be fully seen, we rely on stereotypes and assumptions. We look at a very small frame. We're not looking at the bigger picture of what brings them in and how they're experiencing their world. And we do also know this, which is part of what makes this work so challenging and rewarding, is that there's always a dialectic of knowing and unknowing. I will never fully understand and know my client's experience. But the MCO spirit is around, I can never know your experience and I will always try. And there are so many points of shared humanity. So how do we help our clients be fully seen? How do we broaden the frame through which we understand their experience? So all this to say, if there are just 3 questions to keep in mind and building our MCO mind, our MCO muscles, I've talked a lot about the 3 pillars, but if there are 3 questions that you take with you and practice, it is these 3. What did you notice? What are you curious about? And what parts of who you are may be influencing your curiosities? So we're going to do a little bit of practice. So, all the talk that I've kind of shared, if there's 3 questions, these are the ones that I hope that you take with you because this represents MCO in a nutshell. So to begin, cultural frames of reference, using that frame idea, we have our own frames through which others view us. These are identities that we hold salient, and these are not exhaustive of our identities. So gender, race, ethnicity, citizenship, ability, size, mental health, and many other salient identities to be really clear on what these are and that they shift from interaction to interaction. So here's just one example, and I draw it in a wheel. It's kind of clear. So here I am in the middle, and here are my cultural frames of reference. I'm a mother, I'm able-bodied, I'm Chinese, I'm a psychologist, I'm middle class, I have tinnitus, I'm shortish. I'm not claiming short, but shortish. Okay, so here are my cultural frames of reference. And why I share this with you is that whenever I am in an interaction, whether it's in clinical work or teaching or out in public, that these different parts of me are going to sort of light up and be most salient and come to the foreground. Okay. So I don't think we have time to go through an exercise today around my own identities, but I want you to just sort of start thinking a little bit about which one of these identities kind of stand out to you first. And then you would say, what do you notice? And then what are you curious about? And then what aspects of your own identities might be tied to that curiosity? So for some of you, it might be like, oh, I notice tinnitus. And then I would say, what are you curious about? Like, how does that affect you? How does that impact your functioning? How bad is it? And then I would say, what aspects of your own identities might be influencing your curiosity? And for some of you, you might say, I have tinnitus myself, and I'm really curious. And so it comes from back to this idea of like what prompted your initial noticing or guess, back to the cow frame. There's something about you that is drawn to an aspect of me. And how do we become aware of that? Because that will influence your next interaction. Okay, so we're going to put this together in this way. You're going to meet a client, and I'm gonna show you two different sorts of conversations between Van and Van's therapist. And we'll have a chance to talk through those three questions. Okay. You're going to jot down what you notice, what you're curious about, and what identities might be influencing your curiosities. So these are the three questions. Okay. So to begin, I will share a little bit about Van. Van is a Vietnamese American woman. She's 30 years old, bisexual. She's seeking treatment for depression symptoms. Recently moved from Oklahoma to San Francisco. Works at a small tech company. Her parents were refugees. Then we have Miles. And Miles is a psychiatrist who's 60 years old, Jewish, white man, gay, married with two children, ages 22 and 27. Parents both have PhDs, upper middle class, grew up in Berkeley. Okay. So in chat, these are the same demographics that I had earlier. Type in the responses to these three questions. What do you notice first? Could be from either Van or Miles. What you're curious about. And then back to the identities. What identities might be influencing your curiosities? Okay, so I'm going to give you a minute to just type in your responses to those three questions. There's no right or wrong, and it's not a diagnostic at all. We are practicing MCO mind. And, typically when we meet someone and we get this information, we are already formulating lots of narratives about who they might be. And so now we're kind of bringing them out. Let's see, Sarah knows gender and cultural differences, age between them. Cheryl, depression and refugee parents. Megan says Miles is affluent background. Great. So Celine, you noticed parents were refugees. You were curious about how Van's parents' experience affected Van growing up. And here's where we do the last part that is super important. So Celine says, while I'm not a refugee, I'm also Asian and an immigrant. So identifying the parts of who we are that might be leading to that curiosity helps us recognize, our perspective of the client, maybe direction, maybe things that we're leaning toward. And that's really, really important when we want to think about cultural humility and our openness. We're open to learning about them from what positionality, right? Let's see what else we've got there. Madeline, thank you. At first glance, seems like they don't have much in common. Curious if they have an overlapping experience, areas amongst all of their differences. Curious about what Van's needs are in therapy for how they want to get help. I am more from a background like Van's. That's why I noticed this difference as I think about how I would approach being supportive to her as well. Thank you. So many of us notice something right away. We get curious about it. And to practice MCO mind, the next part is super important. What identities, what about us, right, is influencing that, right? Luna is curious about how Van's parents' status as refugees affected Van. Luna says, I'm an immigrant and come from a low socioeconomic status. I feel I relate a lot to of Van's identities. And so what you're seeing here in chat is recognizing there are so many places that we can go in terms of getting to know Van a little bit more if Van was our client. And that it doesn't just come from sort of thin air. It comes from a lot of who we are. And so multicultural orientation is about recognizing how much of ourselves is a part of that interaction and where we go. Okay, thank you so much for those of you entering into chat. And Tiffany, I'm recognizing we have 8 more minutes. Is that right? Okay. So I want to just show you really briefly, hopefully, 2 conversations. And the first one is, again, symptom focused and showing you a little bit of how when we take cultural markers and we delve into cultural opportunities, different sort of conversations emerge. So for Van, in her session with Miles says, I've been so exhausted. I sometimes wonder if I'm a Vietnamese Dorothy from The Wizard of Oz. I don't know how I got here. Coincidentally, my dog's name is Toto. Miles, that is a coincidence. You've been so exhausted. Tell me more what this looks like. And Van says, well, I just can't seem to get enough sleep. Even when I sleep for 8 hours, I wake up tired, and I'm just dragging through the day. I need more caffeine than usual. How does your energy level and sleep pattern differ from the past? I prided myself on having a great morning routine. Before I moved here, I went to bed at 10, woke up at 6, went to the gym or for a run, and even had time to meditate for 15 minutes almost every morning. None of that is happening now. What has your mood been like? Pretty low, nothing overly concerning, just blah. Nothing too concerning? Tell me more. I mean, I'm not suicidal or anything, just feeling kind of numb, no real highs or lows. Based on how you've described your general mood in the past, this is unusual for you. You also mentioned feeling like Dorothy from The Wizard of Oz. What do you mean by that? So I want to just highlight that Miles is following up on symptoms. You know, Van came in for depressive symptoms and is just sort of following in that sort of line of exploration. But I want to show you another way that Miles um, oh, responded here as well. And what you notice when you take a cultural opportunity and follow some cultural markers. So Van says, I've been so exhausted. I sometimes wonder if I'm a Vietnamese Dorothy from The Wizard of Oz. I don't know how I got here. Coincidentally, my dog's name is Toto. I know the original story. Tell me more about what you mean by being a Vietnamese Dorothy. I grew up in a town where there were very few Vietnamese and Asian people, and now I'm here in New York, or actually should be San Francisco, where there are so many. You'd think I felt at home, but instead I feel out of place. Everything in San Francisco is also so expensive. I imagine it can feel more isolating when you had expected to feel a greater sense of belonging in a city with so much more racial diversity and a bigger Vietnamese community. What does it feel like to be Vietnamese here in San Francisco? This is going to sound strange, but I don't feel like I'm legit. I don't speak Vietnamese. I don't celebrate any of the holidays. I feel like a fraud. Last week during Vietnamese New Year, I went out alone for a burrito. Speaking Vietnamese and continuing some traditions would make you feel more legit? How so? Man, growing up, my parents always wanted me to speak Vietnamese at home. Their English was not very good, so I was embarrassed by their accents. Now I feel a lot of guilt about not listening to their stories or learning the language. Sounds like you want to be more connected to your Vietnamese heritage, yet don't know how to do that. Moving away from Oklahoma has led to this realization. For sure, I don't know. This feels heavy for you, a lot to unpack. For sure, a lot. And I'm also still unpacking boxes too. So Van starts with the same opening to Miles. And what you noticed in this one is that what Miles follows up with immediately is the cultural opportunity. Tell me more about what you mean by Vietnamese Dorothy. So similar to the earlier example, using Van's language and going down a different and following a cultural marker. And for some of us, we might think, well, this isn't really following the sort of symptomology, what Van came in to talk about. Van came in to talk about depression and anxiety. And so this isn't really um, directly doing that. And I'd love to hear in chat, like, what are you learning differently about Van? What do you notice in terms of the difference between the symptom-focused interaction and the culturally focused interaction? Van has a lot more to say. Thanks, Cheryl, for the cultural. More emotions are shared. Madeline, thank you. Might be shedding more light on what could be leading to her new symptoms versus just what symptoms are. Yes, exactly. Luna says how isolation and lack of community might be affecting Van. More genuine. The cultural piece gives more meaningful context. Yeah. Erica says how her identity and sense of self might influence the way she sees herself and how she thinks others see her. So I want to, I'm not saying one's better than the other. And the culturally focused interaction, as many of you have highlighted, gives you a richer understanding of Van, and it makes the connection between what depression means to her, how it might be related to her isolation, her lack of Vietnamese community, her feeling sort of unsure of her identity, right? And yes, Casey, you got it. It's following more of the fuller picture, right? So to end our time together, I hope that this has been a useful webinar, and that what we really want, and I love Claudia Rankine who talks about the goal around MCO is how we have conversation so that the space can hold discomfort, so that the thing isn't a thing that you put over there. And what I mean by the thing is race, um, gender, disability, that we don't put it over there, that we can get over ourselves, and that all of us, people of color, white people, that we suddenly have a moment where we have an investment in a kind of possibility that is beyond our negotiation of each other. And the messiness of just saying what it is when it is, making explicit, the implicit explicit, recognizing our cultural frames of reference, that every interaction is a new interaction, and that how do we build that cultural fortitude to stay in the room and name the thing even when we're uncomfortable. So thank you so much for your time. I realized I've gone all the way up to the hour. I'm around if folks have questions but thank you so much.
Yeah, thank you, Karen. That was amazing. And ending on this quote, which is, I think, really beautiful. And you're getting some love in the chat. There were two questions that came in, but I think that they can be answered. Everyone has your contact information. One was about if someone wants MCO training at their site, how do they facilitate it? So I'm just going to tell them to reach out to you. And then another one was as a new therapist in training, any reading or advice. And so I will say we will post these slides and this recording, which has a ton of references in it. They'll be up on our website within the week. But Karen, on our last parting thing, is there like one book that you would recommend or one thing you would encourage like a new person to read that might help them dig into this further?
Oh my gosh, this is putting me on the spot. I have so many
I'm
books.
so sorry. I know.
Oh my gosh. I mean, I love, I mean, Claudia Rankine she has this book called Just Us, which is beautiful. Anything that she has written is just incredible. And sometimes for those of you who are students, you get a lot of textbooks. I encourage you to move outside, and sometimes fiction is where it's at, and non-textbooks. So this is what I can think of in the moment.
I love it. Thank you again so much. We're going to end this webinar today. Appreciate everyone for sticking around. Do your CE evaluations if you want it, and join us for our next one next month. Take care.